Hello everyone, I'm Mohammed Talal, fourth stage medical student, and I will present the subject in forensic medicine, which is the burn. This subject is supervised by Dr. Karam Turath. What is burns and how we can classify it into the severity? What is the main feature of the antemortem and the post-mortem burns? What is the complication? What is the management, the diagnosis and the treatment of the burns? All these subjects and with the clinical pictures we will discuss in this lecture. So let's go to the lecture. Here's the lecture in forensic medicine, which is the burns, presented by me and supervised by Dr. Karam Turath. We know that the injuries are the mechanical injuries, the thermal injuries, the electrical injuries, and the chemical injuries. Heat is form of energy which when transferred to body produced thermal injury in the form of scalds and burns. So the scalds, which is the wet, produced due to application of moist heat to body, the boiling liquids that can scalds including water, milk and oil, and etc. The burns, which is a dry, produced due to application of a dry heat. Minimum temperature for producing burn is 44 Celsius for exposure of about 5 to 6 hours, while 65 Celsius for 2 seconds is sufficient to cause burns. So we increase the temperature so the burn which more extensive. There are various types of burns, including the burn due to solid object, burn due to flame, burn due to oil, and burn due to X-ray, and the electrical burn here, and the burn due to crossover the substance. The classification based on the depth of the burn and based on the surface area. Based on the depth according to three classifications, which are the Herba, Wilson, and Dubetrain. According to Dubetrain classification, the first degree, including the erythema, the desquamation of superficial layer of epidermis, the second degree, which is the blister formation, the third degree is the destruction of the epidermis, fourth degree is the destruction of whole thickness of the skin, fifth degree is destruction of muscles, and the sixth, lastly, destruction of bone, nerve trunks, and etc. I mean by etc. is the involving the deepest organs in the body. Practically, Dubetrain classification is limited to 3 degrees. The first degree, which is called the superficial degree, the superficial burn, which is called the epidermal burn, which is involving the epidermis of the skin, not the dermis. This lesion is confined to the epidermis, only to the epidermis, and there may be blistering without loss of epidermis. If the blister bursts, reddened base is seen. This picture is showing the first degree, the epidermal burns. Here the second degree, which is called the dermoepidermal burns, called also the partial thickness burn. There's a destruction of full thickness of the skin and the epidermis is coagulated or charred. There is a central zone of necrotic tissue surrounded by first degree of burn, and the scarring is inevitable and is due to formation of contractures. There is disfiguration of the skin. This picture will show the second degree burn. The third degree burn, deep burns, or called the full thickness burn. This is a destruction of deeper tissue below the skin surface. The skin is totally destroyed through in some deep burns. Island of intact dermis may be found, and the damage to the subcutaneous fat and loss of muscle bones is seen. Here we see that the loss of epidermis and deepest to the dermis, and we can see that showing the tendon of the muscles, reddening here, and the desquamation, and here's the loss of epidermis and deepest to the dermis. Classification based on the surface area, it is a rule of 10. All over the body, 10 to the upper limbs, 10 to the left upper limb, 10 to the right, and to the lower limbs, of course, and the genitalia classified into 1%. The burn injury is more intensive and severe according to their intensity, and involving also depends on the area involved, and the susceptibility to the complication of burns in the infant and elder people are more susceptible to complication of burns. The complication of burns. What is the complication of burns? It's the heat hematoma. The hematoma may form in extradural space between the skull and the dura mater, which is the more external, when the cranium is exposed to severe heat. Here's the hematoma is seen in this picture. The heat rupture, heat skin contacts and spells. It is usually seen on elbows, knees, and heat. Here's the picture. And also the complication including the heat rigor. It is observed mainly in muscles. There is generalized flexion of the trunk, arms, and legs. Upper limbs held out with fingers curled inwards, assembling attitude of boxer. This is referred as commonly known as the pugilistic attitude. Lastly, the heat fracture. Due to intense heat, bones get fractured, especially at the cranium. Here's the pictures showing the heat fracture of the skull, and showing the hematoma also inside the skull. The severity of burns depends on the extent of the burn, the degree of the burn, the site of the burn that involving, the age of the patient, of the age of the victim, the sex, the individual susceptibility, and the general health. How to managing the burns? According to the mild to moderate, first aid, cooling area with running water for 20 minutes. In the severe cases, we will check the airway, of course, the breathing, and the circulation. The medication that we will give the patient: the topical antibiotic, the steroid, the calcium and magnesium, the non-steroidal anti-inflammatory drugs. The topical and the ophthalmic antibiotics are routinely used for dermal and ocular burns. In the ocular burns, with the ophthalmic antibiotics. So when the patient comes to the emergency department and we see that he has a burn, we will check also always the breathing, which I mean the airway, the circulation, the burn and the extension of the burn, and we send to him to the diagnosis for the liver function test, the renal function test, according to the site of involvement, the chest x-ray, the complete blood count, the ultrasound of the abdomen, the general examination, and also we expect that the common organ that involving the burn, we will check it by the diagnosis for it. So the causes of death in burns in the first 24 hours is the neurological shock. In the 24 to 48 hours, the hypovolemic shock, and after that, the septic shock will occur. The death due to burn, primary for the primary shock or neurological shock, the second shock due to fluid loss, the smoke inhalation, toxemia, septicemia, biochemical disturbances, the acute renal failure, the edema of the glottis because the airway is not sufficient for breathing, the cutting of the airway, and the pulmonary edema, malignant transformation of burns scar, which called the Marjolin ulcer after years of recovery. The external findings, this important subject in here. The pugilistic attitude results due to coagulation of muscle proteins, and flexor muscles are more affected. The pugilistic attitude is also known as the boxer's attitude. It is not an ante-mortem phenomenon. It's the post-mortem phenomenon. The hair changes due to burns. Of course, the hair will change and the burns. And the heat rupture. This is produced by splitting of soft parts at the joints. And also we see that the lacerated wounds and the absence of bleeding, maybe presence of intact vessels or nerves, irregular margins, and absence of bruisings and other vital reactions. The internal findings that we can see, such as the heat hematoma, we'll discuss it before, be recognized by the presence of soft variable clot, pink in color due to the presence of carboxyhemoglobin and honeycomb appearance. The findings in the ante-mortem burns, we can see the soot in the upper respiratory tract, carboxyhemoglobin in the blood, albumin and chloride in blisters, healing and granulation tissues, increased enzyme in the blister, presence of carbon particles in the terminal bronchioles, the pugilistic attitude, the curling as ulcer also we can see. Here's the ante-mortem and the post-mortem burns, the differentiation. We can see the line of redness in the ante-mortem burn, and the post-mortem burns we can't see, absent. The blister contains serous of fluid with the protein and chloride, and the base of the burn will be red in color in the ante-mortem burns. And in the post-mortem burns we can see the air and thin clear fluid, and the base could be the pale, dry and hard. In the ante-mortem burns we can see the vital reaction present, enzyme activity, carboxyhemoglobin and the carbon particles in the airway, but all of these things we can't see in the post-mortem burn. Here we can see the pictures of the second degree and third degree of burns. Here we can see the pugilistic attitude. Here's the flexion of the elbows, of the knee, the wrist, and strongly flexed muscle contraction. Here we can see the partial and full thickness burns, and here we can see the chest tube and the CV line. Here's the full thickness and partial thickness. Here we can see the full thickness burns and the changing in the color of the skin, which is the brown to black with tissue coagulation. Here we can see the pugilistic attitude is more common for the autopsy for severe burns. Here we can see the thermal epidural hematoma, and here is. We can see here the thermal epidural hematoma in the X-ray up here. Here we can see the evidence of blackened discoloration of the skin and the redness of the skin upside here. Here we can see the burn involving the face and the chest. Here we can see the demarcation erythema between the healthy and the burst area. Here we can see the demarcation of all of these between the healthy and the destruction and the burnt area. Here we can see also the demarcation, the black discoloration of the skin, the erythema here, and the blackened discoloration up here. Here we can see the deep burns with the greenish discoloration here and the yellowish discoloration. We can see the pus formation here, the pus formation over the infected area in burns. Here we can see the granulation tissue and the evidence of scarring here, here. We can see the granulation tissue for healing on the face and on the chest here with the infected area. This is the granulation tissue of the face here. And here we can see the healed area and burns showing the scarring. Here the scar, and here and here. So this is the lastly of finishing the lecture. We have a simple quiz. The bucklistic attitude is seen in cases of hanging, lightning stroke, heat stroke, and burns. Stop the video and answer. Correct, burns. The heat hematoma is present within. Read it and stop the video. Correct. D. Dura mater and skull bone. The references are the textbooks of forensic science and toxicology, the syncope of forensic science and toxicology, the atlas of forensic pathology, and the essentials of forensic imaging. Thanks for listening. I hope this lecture was informative and easy. Goodbye.